Hello and welcome to NewsHour from the BBC World Service. We're coming to you live from London. I'm James Menendez. And our main story today is vaccines, coronavirus vaccines.
I'm Dr. Natasha Kathuria. I'm an emergency medicine doctor and a global health specialist, and I work in Texas. We had a patient who they called a codon, which means that the patient either lost pulses or was, no longer responsive. I left the ER, I went up to the ICU to respond, and at that point we were, kind of in the middle of all of this, struggling with PPE shortages. We didn't have sufficient masks. We were reusing our masks. We have to wear very different gear when we intubate to protect us because it's arguably our highest risk procedure for contracting the virus. You're suctioning airway particles, there's virus pretty much just being thrown around, and you're also trying to work within a very, very short time frame to put a tube in the patient's airway to protect them and save their life. And I realized when I ran up to the code that they didn't have the proper mask for me to wear because they were short. The surgical mask that I was wearing, it was very difficult. You have to make a spur-of-the-moment decision. Do I put my life at risk and intubate this patient? At that time, we didn't know if the patient had COVID. We didn't have rapid testing. We had no idea. So I was very nervous and anxious. And, at that point, you got to make the decision. Do I save this guy's life or do I protect myself and say, no, I'm not going to intubate this patient until I have protection, knowing that that would lead the patient to die in front of you. It's not a decision I think any doctor would do any differently than myself, which is, all right, I'm going to intubate this patient and cross my fingers and hope that I don't get COVID and this patient doesn't have COVID, which I did. The patient was intubated, we resuscitated the patient, transferred him to the ICU. He was saved for the time being, and I was able to go back down to the ER. Luckily, we don't think the patient had COVID at that time. Again, we didn't have testing then. That patient never got tested. Unfortunately, he passed away within 24 hours of that incident. I was fine. I didn't have COVID. And so I got really lucky in that situation. But, a lot of our colleagues around the country didn't get lucky in situations like that. And that was very terrifying. That was the first time I was legitimately appalled that I was even in a situation like that and that this was happening in America after we'd already been through this pandemic for months. Those are just moments where, you feel this level of fear that never before have we had to fear our own health by treating a patient. And it eats at us at night, it scares us. We are all terrified of what's to come, with continued struggles with feeling confident over our PPE supply, knowing that this pandemic is far from over. I've worked in 11 different countries, developing countries, and I've had to deal with shortages of everything. We're not used to that in America. We are the leaders of the free world. We have money. We're supposed to be setting the bar for healthcare. And we hope to set the bar for a lot of things in the world. We hope to be doing everything right and best. And this was a really crazy moment for physicians to see firsthand how we're not leading this fight. And we didn't protect our front lines the way that we thought our government and our country would.
And we're going to start today in China, in the city of Wuhan, where the coronavirus pandemic first began at the end of 2019. A pandemic that, as we'll hear in reports today from Brazil and from here in the UK, is causing devastation to families and the health services treating the most serious cases. By January 2020, Wuhan and the surrounding area were in strict lockdown. 60 million people were confined to their homes in an effort to contain the outbreak. Of course, that didn't work. It quickly spread to other parts of China and swiftly around the world. But Wuhan is now back to normal, and as our China correspondent John Sudworth reports, the authorities want the city to be remembered not for a disaster, but as the scene of a great victory.
Nowadays in Wuhan, it's the mundane normality that's striking. The traffic jams and the bustling streets are all such a far cry from this. In January last year, Wuhan was ground zero, the place where the pandemic began, and the first to experience a lockdown. 1 year on, the city has moved on. Shoppers and sellers throng the streets again.
But also sadness, because the ski lifts stand idle. And that, says Mayor Gloria Carletti, is devastating.
Ma la stagione di Natale noi generalmente facciamo il 50.
At Christmas we make up half of our season. Losing it causes irreparable damage that we'll never make up, and I imagine that some businesses here won't survive it. What we from Bergamo lived through in March was very frightening, hearing the sound of ambulances, and we must take care not to relive it. But the mountain can be enjoyed safely, and closing the resorts is not a fair decision.
An hour back down the valley, we meet Asia Marchesi and her mother, still mourning the loss of her father, Sirio, from COVID. He was one of the over 6,000 who died in Bergamo in February and March alone, more than 5 times the deaths of previous years. He makes a convincing Father Christmas. Sembra proprio Babbo Natale. She shows me photos of her kindly, white-bearded father dressed up as Santa Claus. After dying at home, his body sat for 2.5 days in a coffin in their living room until the overwhelmed authorities could retrieve it.
Someone like him deserved a funeral, something dignified, instead of being thrown into a coffin in our house, like a carcass. There'll be an empty place at the table this Christmas. He was the life and soul of the party, very wise and good-humoured. I'm angry too with the authorities who didn't close down Bergamo fast enough. They put the economy ahead of human lives.
Resurgence across Europe. Very serious situation unfolding before us, announced the Europe Director of the World Health Organization today. Dr. Hans Kluge said that the recent increase in coronavirus case numbers should be, as he put it, a wake-up call for governments. We'll hear more from him in a moment. Across Europe, countries are imposing either national or local restrictions. In Austria, no more than 10 people can gather inside. In England, as of this week, the limit is now 6, indoors or out. And in France, the health minister has acknowledged that there's been an 8-fold increase in cases since July and a growing number of COVID patients needing critical care. Indeed, today the country registered almost 10,600 cases over the last 24 hours. It's a new daily record.
The government doesn't offer an urgent solution to support us, like it did in the past, with restaurants having to close and only being allowed delivery services. We are going to have an even bigger employment crisis, and businesses will close.
The B1 variant that was found in Manaus at the end of last year is complicating things. The biggest city in the Amazon last April saw its health system collapse, and it's happened again. Felipe Naveca is leading the research into the variant in Manaus for the Government Research Institute Fiocruz.
We have confirmed three cases of reinfection. I believe there are much more than that, but those 3 cases were confirmed by nucleotide sequencing. 2 of them had something that really disturbed me. And the first one, she was infected the first time in March, and the second time in December. But at the day that she believed that she was infected, she did a rapid test, so she thought she was protected, and she went to a party. Thankfully, both the 3 patients had mild symptoms, but we don't know if all patients will.
Is hitting groups who are more vulnerable to start with more severely. A couple of really striking things from the UNCTAD report. They estimate that of workers in sub-Saharan Africa, almost 80% of them have no access to any kind of social or protection or labour programmes if they do lose their job as a result of the pandemic. And for the poorest countries of all, the figure is 85%, very nearly. In addition, both reports are saying that young people are particularly at risk. That's because of they often have very precarious employment, often in sectors that are particularly exposed exposed to the effects of the pandemic, that's to say tourism and hospitality, for example, and women as well. Now, in health terms, they are rather less at risk from the virus itself because many more women have this kind of precarious employment, and in those exposed sectors of the economy, they're being particularly hit. And there's an additional factor, which is, of course, that when you have school closures or other measures taken that interfere with childcare arrangements, women are predominantly the ones who have to pick up that burden as well.
You're listening to NewsHour from the BBC World Service. From India, a country about to begin its vaccination programme, to one that's making rapid progress in immunising its public. That's Israel. It is the current world leader in the distribution of vaccines, but it is also under its third national lockdown. More than 3,000 people have died with the coronavirus in Israel since March, with the country's ultra-Orthodox Jewish community amongst the hardest hit. As the BBC's Middle East correspondent Tom Bateman now reports.
There are 4 children playing outside Yoelish Krause's small house. He comes out of the front door. A young girl runs with him. How many children do you have? I ask him. Just 18, he replies. I say I find it hard enough with 2. Yoelish grins. It gets easier after the 3rd, he tells me. They start looking after each other. We're in the middle of Meir Sharim, the beating heart of Jerusalem's ultra-Orthodox community. Cramped alleyways and steep steps lead to Yoelish's place, surged over the spring and summer, and still continues to do its damage. I was one of the first right from the start, but I had it lightly, says Yoelish. My older kids had it worse. They suffered for 2 to 3 weeks, but thank God they survived it.
He has been something of a roller coaster for the tourism industry in the United Arab Emirates. The sector accounts for 11.5% of Dubai's GDP, and the emirate welcomed more than 16.7 million visitors in 2019. They planned for 20 million in 2020, but that all changed in March when the ruling sheikhs closed the borders and brought in a strict 3-week total lockdown. All tourism activities stopped. The malls were mothballed, theme parks closed. Small businesses, many owned by expats, struggled to stay afloat.
Whether it was physical distancing or wearing masks and hand washing and trying to avoid the super spreader events through overcrowded mass gatherings. Many of these actually helped, and the testing, which was at a very low ebb in the initial stages, ramped up. The hospital facilities also improved. And of course, as far as the deaths are concerned, the younger age certainly helped, because India's population over 65 years is only 6% compared to 23% in Italy or 20% in Spain or 16% in the United States. Therefore, the severity of disease and deaths came down. But even in terms of transmission of the virus, I think all of the factors helped. In the rural areas, the virus spreads much more slowly.
I honestly cannot put into words how terrifying and how merciless I was to it 6 days ago. If I can say anything to anyone, it's just literally follow the rules, stay at home. It's not a joke. It really isn't a joke.